Hello everyone. In this video we are going to talk about resisted exercise. Muscle performance refers to the capacity of a muscle to do work. The key elements of the muscle performance are strength, power and endurance. Resistance exercise is any form of active exercise in which dynamic or static muscle contraction is resisted by an outside force applied manually or mechanically. Strength. Muscle strength refers to the ability of contractile tissue to produce tension and a resultant force based on the demands placed on the muscle. Power. Work produced by muscle per unit of time. Force into distance upon time. Endurance. Muscle endurance is the ability of a muscle to contract repeatedly against a load. Overload principle. It focuses on progressive loading of muscle by manipulation. Manipulation depends upon intensity or volume of exercise. Intensity of exercise refers to how much weight is imposed on the muscles. Volume of exercise refers to the how much repetition, set or frequency muscles can perform. Any one or more of these can be increased to increase the volume of the muscles. In a strength training program, the amount of resistance applied to muscle is progressively increased. SAID principle, specific adaptation to imposed demands. This principle applies to all body segments and is an example of Wolff's law. Body systems adapt over time to the stresses placed on them. The SAID principle helps therapists determine the exercise prescription and which parameters of exercise should be selected. Specificity of training. Specificity of training also refers to as specificity of exercise. Improvement of strength, power and endurance are highly specific to the training method employed. For example, if desired functional activity requires greater muscular endurance, then strength, the intensity and duration of exercise should be geared to improve muscular endurance. Specificity of training should also be considered relative to mode and velocity of exercise as well as patient or limb position and the movement of pattern during exercise. For example, if our aim is to ascend or descend the stairs, exercise should be performed eccentrically and concentrically in a weight-bearing pattern and progressed to desired speed. It has been suggested that the basis of specificity of training is related to morphological and metabolical changes in the muscle as well as neural adaptation to the training stimulus associated with motor learning. Transfer of training. In contrast to the SAID principle, carryover of the training effects from one variation of exercise or task to the another has been reported. This phenomenon is called as transfer of training, overflow or cross-training. It has also been suggested that a cross-training effect can occur from an exercised limb to a non-exercised contralateral limb in a resistance training program. A program of exercise designed to develop muscle strength has also been shown to improve muscular endurance at least moderately. Reversibility principle. Adaptive changing in the body's segment such as increased strength or endurance is response to a resistance exercise program. Detraining is reflected by a reduction in the muscle performance, begins within a week or two after the cessation of resistance exercise. Types of resisted exercise. There are so many types of resisted exercise, but broadly it has been divided into two major types: manual resistance exercise and mechanical resistance exercise. Other types of resisted exercise includes static exercise which is isometric, dynamic exercise which is concentric and eccentric, isokinetic exercise, open and closed chain exercise. Manual resistance exercise. Manual resistance exercise is a form of active resistive exercise in which the resistance force is applied by therapist to either a dynamic or a static muscular contraction. Uses of manual resistance exercise. This technique is useful in early stage of an exercise program when the muscles are too weak and can overcome only minimal to moderate resistance. The manual techniques work well if the patient needs assistance through a portion of range of motion followed by resistance at other positions. Advantages of manual resistance exercise. Resistance is adjusted throughout the range of motion as the therapist responds to the patient's efforts or a painful arc. The range of joint movement can be carefully controlled by the therapist to protect healing tissues. It gives the therapist an opportunity for direct interaction with the patient to monitor the patient's performance continually. Disadvantages of manual resistance exercise. The amount of resistance is subjective. It cannot be measured. Amount of resistance is limited to the strength of the therapist. Therefore, resistance imposed is not adequate to strengthen already strong muscle groups. It cannot be performed independently by the patient to strengthen most muscle groups. Patient cannot use as home program unless assistance is available. It is labor and time consuming for the therapist. Mechanical resistance exercise. Mechanical resistance exercise is a form of active resistive exercise in which resistance is applied through the use of equipment or mechanical apparatus. Uses of mechanical resisted exercise. When the strength of the patient exceeds the therapist's strength. Advantages of mechanical resisted exercise. The amount of resistance can be measured. Disadvantages of mechanical resisted exercise. It is not appropriate when muscles are very weak or soft tissues are in early stage of healing. Machines, especially semi-isokinetic devices, are usually more expensive than free weights. Isometric exercise. Isometric exercise is a static form of exercise in which a muscle contracts and produces force without an appreciable change in the muscle length and without visible joint motion. Uses of isometric or static exercise. Isometric exercise is essential to maintain muscle strength and prevent muscle atrophy when the joint motion is not possible or during immobilization, when limb is within cast or splint. It is also used to improve muscle strength when dynamic or isotonic exercise could compress joint integrity or cause joint pain. Precaution of isometric or static exercise. Isometric exercise can produce a pressure response, increasing blood pressure. Advise the patient to perform isometric exercise without breath holding. High intensity isometric exercise may be contraindicated for the patient with a history of cardiac or vascular disorders. Dynamic exercise. In that eccentric and concentric exercise. A dynamic exercise is a type of exercise in which muscle contraction causes movement of the body and the body segment. It is also known as isotonic type of exercise. Concentric exercise refers to the form of dynamic muscle loading in which tension in a muscle develops a physical shortening of the muscle occurs as an external force or resistance is applied. For example, lifting a dumbbell for biceps muscle strengthening. Eccentric exercise refers to as dynamic loading of a muscle beyond its force producing capacity, causing lengthening of the muscle as it attempts to control the load. For example, lowering the knee joint against the resistance in sitting causes eccentric contraction of quadriceps muscles. Body weight, elastic bands, free weights, pulley, manual resistance, and weight machines are a few modes of dynamic resistive exercise. Isokinetic exercise. Isokinetic exercise is a form of dynamic exercise in which the velocity of muscle shortening or lengthening and the angular limb velocity is predetermined and held constant by a rate limiting device known as isokinetic dynamometer. Uses of isokinetic exercise. The isokinetic mode is used most frequently for muscle performance testing and training. Advantages of isokinetic equipment or exercise. Isokinetic equipment provides maximum resistance at all points in the range of motion as muscle contracts. Both high and low velocity training can be done safely and effectively. As a patient fatigues, exercise can still continue. Disadvantages of isokinetic equipment or exercise. The equipment is large and expensive to purchase and maintain. Most units allow only open chain non-weight bearing movement patterns, which do not allow most lower extremity function and some upper extremity functions. Open and closed chain exercise. Closed chain exercise are those exercises where the distal segment is fixed on a rigid or semi-rigid surface. For example, squats, lunges, or push-ups. Open chain exercises are those exercises where the distal end is free, as in performing a straight leg raise, resistive knee extension, or biceps curl.